Good evening, and I want to thank everybody for coming. My name is Greg Wormser, and it's both my honor and privilege to be your fire chief and the fire chief for the city of Lynchburg. We're here to inform you that one of our firefighters who had recently been tested for the COVID-19 virus received positive test results today. So I'll be reading from a prepared statement, and then we'll take some questions afterwards. He has been in self-quarantine since he first became exhibiting symptoms, and he's currently at home resting comfortably with his family. The firefighter had not been at work since early last week and did not report any symptoms while he was at work early last week. The last time he was at work, his work shift was such that he was not in contact with any patients in our community. The 8 firefighters that he was stationed with, none of which have exhibited any symptoms, have all gone into self-quarantine out of an abundance of caution. These firefighters are located at Station 1, which is our downtown station, the same station that he was assigned to. That station has been temporarily closed and will undergo a deep cleaning with an anticipated reopening date of later this week. The apparatus that serves that station in the neighborhood of downtown has been cleaned and will be reassigned to other stations first thing in the morning. We will be bringing in other firefighters who staff our apparatus while their colleagues are in quarantine. We want the public to know that all necessary precautions are being taken to ensure their safety and the safety of our employees. They can continue to count on the Lynchburg Fire Department to provide the very best care possible. We want to remind everybody in our public, listening to this, watching the news, follow the safety guidelines of staying at home, washing their hands, social distancing, and covering their mouths appropriately when coughing. Finally, I would add that we are certainly thankful for all the outreach that our public has provided to us, and our thoughts and our prayers are certainly with our firefighters and our fellow first responders, nurses, doctors, and other people on the front lines that are fighting this virus every day. I'll now turn it over to Deputy City Manager Dr. Reid for a few comments.
Hi, good afternoon. As the chief said, I'm Reid. I'm the Deputy City Manager for the City of Lynchburg. First of all, I want to thank the chief and his team for their leadership on this issue by proactively addressing the concerns that are out there. We feel very strongly that we will be moving forward appropriately. Our thoughts and our well wishes are with the firefighter that this affects, as well as his family. We are very thankful that he is doing well, and we wish him certainly a very speedy recovery. We also wish the other 8 firefighters that will be quarantined the very best. Lynchburg firefighters, just like every other city employee, are vital to the long-term success of this community. So we want all of our employees to know that we take their safety very seriously, and we will continue to serve the public the best possible way that we can while doing everything that we possibly can do to make them safe, keep them safe. I want to let the community know that together we are Lynchburg strong. Lynchburg is a wonderful community, and we want everyone to know that we take the COVID-19 virus very seriously. We hope that everyone in the community will continue to do so. We would encourage everyone to follow the guidelines, just as we are doing in every situation where there is a potential case. So let's beat this thing together. Again, thank you to the chief and his team for their leadership, and we will take any questions you might have.
Can you run through that breakdown again of the firefighter's history, where he's been? You said he had no contact with patients and had not been to work, right? So can you just run through that again one more time so we have clarification?
Sure. So the firefighter who tested positive had not been at work since early last week. The last time that he was at work, he did not have any patient contacts. He was assigned to a duty that did not require him to interact with the public or a particular patient while he was at work. So he has been off for already more than 7 days.
Had he been seeing symptoms, showing symptoms at that time when he was doing the work that doesn't involve the public?
When he was last at work, he did not express that he had any symptoms.
How are you feeling given, VDH has already said numbers are going to keep going up, and here you are, one of your guys are involved, so how do you feel?
Yeah, it's certainly been afternoon that I probably will not forget, mostly because my thoughts, prayers, and certainly well wishes are with all of the firefighters who are affected by this. It doesn't just affect this one firefighter, it's going to affect many firefighters. And so our department is resilient. We have some of the best firefighters, paramedics, and EMTs in the country. I'm convinced of that. And they do great work every day. And I know that although today is a bit of a challenge, that tomorrow will be better.
How does this impact staffing? Because now you've got 8 firefighters that are out in addition to this one firefighter.
Yeah, so we have called in staff who will staff the apparatus in the absence of the firefighters who are currently self-quarantined.
And then as a department, are you all prepared to even just help the public? Do you have that PPE equipment that, they've been stressing for first responders to have? Are you guys ready?
Yeah, so we're very thankful that we have a great team that had been planning for some time, and we have certainly a great cache of PPE for all of our employees. I will say that cache of PPE, the personal protective equipment that we need, is not unlimited. There are certainly some supply chain challenges there, but today, right now, we have the necessary PPE. We have gowns, we have masks, we have gloves, we have the face shields, and all of the things that are necessary in order to protect our providers to the best extent possible. Additionally, those things also protect the public.
And then how many firefighters do you have on roster total?
We have a total uniform staff of operations of 159 personnel.
Do you all plan on getting any of those firefighters tested, given that this one person tested positive?
We will be following the CDC guidelines and the Department of Health guidelines with regard to testing those firefighters. I can assure you that those firefighters are going to be taken care of to the best of our ability. We're proud to say that one of the things we do best is protect our best asset, which is our people.
And you were talking about those 8, right?
That's correct.
Okay, so as a whole department, will the whole department be tested as well, just to be sure?
No, ma'am, there's no plan currently to test the whole department. We would be following the CDC guidelines as well as the Department of Health guidelines.
Do you have any idea how we might have gotten it? Did you come in contact with anyone who potentially had it?
We currently have no idea, and we're working with the Department of Health. Dr. Gately is here with us tonight to see if we can determine, what that path might be.
Can you say if his family had been tested as well?
I cannot pass that information along.
Is he quarantining with his family or separate?
He is at home with his family.
Were they also given instructions not to leave the house?
Yes, they have been in contact with medical professionals to provide them the best possible information as we know it today. Dr. Gately, did you have anything that you wanted to add?
Perhaps just one thing. It's clear now, I think, to everyone, or it should be clear, that the virus is here. And we've been watching cases and case counts grow all over the world and certainly all over the Commonwealth. And now we're starting to get a pretty high number of cases here in this area, in the Central Virginia Health District. So again, I want to emphasize the necessity of following the guidelines that we have been providing, whether that be social distancing, hand washing, surface cleaning, everything that we've talked about. It's more important than ever that be done all the time. You can't, in the circumstances we're in now with community-acquired transmission, you can't rely on information about who might be infected or might not be infected or rumors. I will point out that one of the things that we're learning about this virus, SARS-CoV-2 and COVID-19, the disease that it causes, is that there are a fair number of people who are asymptomatic. And what that means is they can be shedding the virus and having no symptoms, cough, headache, the other things that we have talked about. And such a person is not going to be doing anything to intentionally infect anyone else. And yet, nevertheless, if they don't follow the practices that we're talking about, they could infect other people. If you don't follow the practices that we have been talking about and that everyone's been urging from the president and the governor on down, then you could be exposed without ever knowing where you got the virus from. So it's time for us to be careful all the time.
Well, if there's no other questions, thank you for coming, and let us know if you have any follow-up questions. Thank you.